Hi, I'm Dr. Leigh from Your Vet Online, and in today's tutorial we're going to be talking all about horse breeding, and what's more, we have equine veterinarian and reproductive specialist Dr. Simon Robinson joining us to give us all his top tips on how you can breed your mare quickly, safely and successfully. So if you want to never miss another tutorial, make sure you subscribe below and give us a thumbs up if you enjoyed this tutorial. Alright, let's get right to it.
And yeah, so I'm Dr. Leigh. If you haven't met me before, I run Your Vet Online, and this evening we're going to be talking all about horse breeding. And this talk will be perfect for anybody, whether they want to breed their own horse, whether they're sending a mare to a stud or to a farm to be bred and they're not sure what's been going on and they need to understand a little bit more about that sort of stuff. And as I said before, we're very lucky we have equine reproduction specialist Dr. Simon Robinson with us to help us all out with all his best tips. So if you're watching, make sure you say hi and let us know in the comments if you're actually planning on doing any of these, if you're actually planning on breeding any horses this year. Anyway, we're going to introduce you all to Simon Robinson here, and we'll just get Dr. Simon up. Hello. Dr. Simon Robinson is an equine reproduction specialist, and I'll leave it up to Simon to tell us all a little bit more about himself and what he does.
Okay, thank you, Dr. Leigh, and good evening, everyone. I'm a reproduction specialist based in Victoria. I'm one of the partners at Victorian Equine Group. We've got our hospital in Bendigo, but also service around the Shepparton, Nagambie, Murchison areas in Victoria. And I guess my main area of expertise and main practice experience has been in equine medicine, equine reproductive medicine and stud medicine. So that's my background. I've been working on studs for probably around 25 years now, and been working as a veterinarian for about 13, nearly 14 years now.
Oh, I think I might have been working as a vet for longer than you. Oh God, I'm feeling my age. Oh well, we get that with the big jobs, don't we? So welcome, Simon. I hope everyone will enjoy this evening's little. So first things first, let's talk about the horse breeding and what do we need to decide, Dr. Simon, before we even actually decide to breed our mare. Are there any top things that you want people to actually think about?
Well, I think one important consideration early on is why do you want to breed your mare? So it's quite obvious if you're breeding for a racehorse, whether it's a standardbred or a thoroughbred, you want to breed a racehorse. But it's not uncommon for people to breed just because they have a mare. And we do have an issue in Australia where we have a lot of foals that are born each year out of a mare that doesn't necessarily have a pedigree, by a stallion that doesn't necessarily have a pedigree, and they, other than being something that's really cute when it's born and you can rear it and things like that, they don't really have a plan for a purpose. And so I think it's important from a welfare point of view is to be sure about why you're breeding what you want to breed, because it may be an opportunity to go and buy a horse off someone else rather than breed it yourself. So I think that's an important welfare consideration. But otherwise, I mean, if you're going to breed, and lots of people do breed each year, and we encourage people to do so, and most of us can only get one baby out of their mare each year, well then certainly go along and talk to your veterinarian, because we're there to help you get that job done, whether you're breeding naturally or by AI or using embryo transfers.
Yeah, because I guess that was what one of the other thing I was going to talk about, and is I'd like people to have a little bit of a opportunity to learn whether, I mean, aside from the fact that some breed societies and some like racing societies, of course, we all know thoroughbreds are not allowed to breed by AI, standard breeds you can, but what are some of the considerations we need to make as owners, whether we decide to do natural service or whether we go towards AI? Because there are some quite different considerations if you're going to do both of those things, and one might cost more, it might, you know, there's costs, there's logistics. Can you talk us through all those?
Yeah, I mean, you may be forced to or coerced to breed your mare by a certain means. For example, as you mentioned, if you're wanting to breed a thoroughbred, the stud book rules you need to use natural service, and then if you go into commercial stallions, you're going to have certain expenses as far as swabbing the mare and transporting it to the stallion and things like that. So they're unique costs and services involved with breeding the thoroughbred. Whereas if you've got the option for using AI, well then you may choose to use fresh semen from a local breeder, chilled semen from interstate, or frozen semen, which may be imported. And the importation of frozen semen has made a huge difference across a wide range of breeds in Australia, predominantly the quarter horses and the warm bloods. I mean, we now have multiple generation mares that are being bred with imported frozen semen now in Australia, and so we've really established our own breeding using internationally imported bloodlines, and so they're important considerations. And as you say, there's various costs in breeding your mare, but I think that the key in minimising the costs is to get good advice and use experienced operators. And so whilst most people have bad experience with having a big bill or a bunch of mares not in foal at the end of the year, or no of experiences, whether it's frozen semen, natural service, chilled semen, you can have those bad experiences equally with each of those. But similarly, if you use the right expertise and put the right work in early on when you want to breed, well then you can minimise your costs regardless of the way you go. And I think that's the key, is to use experienced people and get advice from experienced people as far as breeding your mare, and that's how you'll minimise your costs regardless of how you go.
Yeah, and I guess that brings us to the next little part that I really want to get down to the nuts and bolts of things, so to say, and how, like, can you walk us through? And actually, Sheanne asked a question here, which is very much related to this. She asked about getting a pre-breeding swab performed, and I guess this actually. You know, whether you should do that, is it something, is it part of the process when you first become the vet with a client, and what would you want them to do as you progress and before you actually get into the actual breeding process, and as you go through the whole process, like their breeding soundness exams? What are all the things you need to do and to consider, I guess?
Yeah, well, I think the starting point is just to have a conversation with your veterinarian about what you want to do. So, I mean, the things we need to know is who you're looking at breeding your mare to. Is it a thoroughbred stallion to produce a thoroughbred stud book foal? Is it going to be with AI, frozen semen, chilled semen? What do you know about the stallion? Where's that available? And then have a conversation about the mare and the history of the mare. If it's a young maiden mare with a good reproductive history, or a mare with a good reproductive history, we may not do anything more other than just scan or examine her and get a starting point.
And so by examination, are you talking about looking up with a speculum? You're taking any swabbing, primarily just checking out her external features and doing the scan and looking at ovaries and the uterus and making sure that's all fine.
Yeah, I mean, if it's a mare with a good history or a maiden mare, I mean, we as a reproductive specialist, we always start at the back end. So I mean, I think we would plan on scanning the mare to look at her reproductive tract internally, and it's a technique which we've had available for a number of years, and it's really been a game changer as far as monitoring cycles and improving fertility of mares. And obviously we're there anyway, so we have a look at the mare's back end, the conformation of her of a vulva. I think I can say that on Facebook.
Yeah, it's not a picture, so you're probably fine.
and have a look at her conformation, check out her udder, and get an idea of things that may be a problem there. And so the maiden mare, we can generally launch in and do those sorts of things and then find a starting point. It's an empty mare that's been bred previously and not gone in foal or lost a pregnancy. Well, then it's a different situation. We certainly want to get a good idea of her history, find out where the failing points have been, whether she didn't go in foal or she went in foal and lost a pregnancy early or late. And then we would certainly look at doing some further diagnostic tests and things like taking swabs from her uterus in particular and maybe other parts of her tract, or even taking a biopsy where we put an instrument in and take a small sample of the lining of a uterus, and that gives a good ballpark indication of the health of a uterus. And an important thing to remember with mares, and this is important whether when it comes to the pregnancy and holding pregnancies and getting them in foal, is that mares don't have a menstrual cycle, and so that the uterus and the lining of the uterus, or the womb that they're born with, is the same one they have at the end of their life. And so it undergoes all sorts of rigors and challenges and things through their lives with foaling and breeding and infections and inflammation. And so at the older mare is, and the more reproductive history she has, the more likely that lining of the uterus is degenerate, and her ability to go in foal and maintain a pregnancy is reduced. And so a biopsy and a swab are quite useful initial diagnostics to perform on a mare that has tried to breed her in the past and she's not in foal.
Okay. And what about doing that? I mean, I know that there are some stallions, we do have some diseases in Australia in particular, and some of the people in the US will have diseases. There's a couple in New Zealand as well where we take swabs as a regular feature before going to a stallion. Is that something we have to do every single time, or is that if we're going back to the same stallion, can we be assured that maybe we should be okay? How do we sort of manage that?
Well, it's only really mandatory in breeding to commercial thoroughbred stallions, and so most of the commercial studs require us to take pre-breeding swabs from the uterus and the clitoris at the start of the season. Then if the mare misses in a cycle, well, then in subsequent cycles, and that's to exclude some specific uterine or sexually transmitted pathogens that basically may harbour in the mare, and we don't want it to be transmitted to the stallion that can then pass them on to other. So that's routine. It's not commonly done as a pre-breeding screen other than with the thoroughbreds. However, if the mare has indications of inflammation or infection in a uterus, whether it's at the first cycle or after missing a cycle, we would want to try and do that to get an idea of what's going on in there, to exclude those uterine pathogens that are sexually transmitted, because that's only going to cause a cascade of problems through the breeding industry if you're going natural service, but also it's going to stop your mare from going in foal. And that's what I was talking about earlier. I mean, if you miss a mare, I mean, you shouldn't just do it all again and do the same thing. It's silly doing the same thing again. You should take some diagnostics, some swabs, maybe a biopsy, and try and improve your chances the next time around.
And I guess that's where an important point is. If people are using technicians and non-veterinarians, this can sort of lead to a situation where maybe you keep retrying the same things without those extra diagnostics, because those people might not necessarily have the skill set to be able to either A, recognize problems, and two, actually don't have the equipment or the facilities or anything to actually be able to take those swabs and take those biopsies and that sort of thing. So if you do have a problem breeder, I think you'll agree that that's when your veterinarian is the best person to actually handle those cases.
Yeah, and look, I think regardless of whether it's a problem breeder at all, I mean, I do a lot of work across a number of breeds, and the common thing is that everything's becoming more expensive, and it's becoming expensive to breed, and the price of progeny that people are getting for progeny, whether it's a quarter horse or a warm blood or a thoroughbred or a standardbred, aren't going up at the same rate. And so we should be trying to minimise our costs. And I think the number one way we can do that is to use experienced people, and to do everything we can right from the start. So not just have a half-hearted go in the first cycle and hope for the best. But do everything we can from the start, because if you can get your mare in foal in the first cycle, well, then that's how you're going to minimise your cost. If the mare's boarding somewhere, you're going to reduce your agistment cost because you can get her home sooner. You're not going to have to reorder semen and pay transport costs. You're not going to have to drive her to a stud to be covered. And so the important thing is, whether it's a problem breeder or a maiden mare or an excellent breeder, is to do as much as you can and get the best advice right from the start. Because that's how you're going to reduce your costs. It may cost a little bit more for that cycle, but I mean, I've been looking at statistics, and people talk a lot about AI and chilled semen and how much of a game changer that's been. But across a number of breeds, the per cycle pregnancy rate, so the percentage of mares that go in foal to a given AI with chilled semen, is about 30%. So that means 2 out of 3 times that you order semen or a stud sends out semen, you may as well throw it down the drain, because the mares only go in foal 1 out of 3 times, and that's not good enough. That means there's a lot of scope for us to do better. So, I mean, we like to think that a good per cycle pregnancy rate is 57-65%. So 2 out of 3 times your mare goes in foal, and often with chilled semen it's the opposite. It's 1 out of 3, and that's a lot of scope. So to improve what we're doing and to get better advice and to do things better from the outset, because we shouldn't have to take 3 cycles on average to get a mare in foal.
Absolutely. And talking about the length of a cycle, can you just tell everyone how long a cycle actually is? And if you had the perfect mare that did everything textbook, how many times do you think you would scan? And we're talking about a mare that's got no issues. Absolutely. And she basically, her follicles form, they ovulate normally without using any drugs, you know, or actually maybe we can use some drugs, make it a bit easier. But yeah, can you let everyone know how long a whole cycle goes, and then for a mare that does things absolutely textbook, what could we expect? How many times would we scan and do the whole procedure?
So an average cycle is about 3 weeks, 21 days, and the mare's in heat for about a third of that time, so 5 to 7 days in heat and about 14 days or so off heat or in diestrus. So in heat is estrus, off heat is diestrus. And so so if you were to leave everything to the mare doing it, and there's some variation in that, some mares have longer times in and some mares show more profound heat signs, and others perhaps sort of silent heats, and so if you just leave it all to the mares, it can be very difficult to work that around maybe a weekday sort of situation when you're trying to breed a mare or get access to semen.
Daylight.
So whilst so exactly. So whilst at the normal cycle, we rarely let horses do that, and that's where we use our reproductive drugs, things like prostaglandins, which is very commonly used and very inexpensive drug. And then the other common one we use to manipulate the cycle is to use drugs to induce things like G and plant. And so what we're trying to do there is basically to make things more convenient and reduce the number of times we've got to look at the mare, because they're all different. They don't read the textbooks and all come into heat as expected and things like that. And some of them can show heat right from early on in estrus, and then you may end up reading them multiple times. And so as far as scanning them, obviously, I mean, one way of sort of reducing the number of scans is to, if you're able to tease the mare, know that she's well off heat and been off for a week, well, then that's a good starting point, because then we can look at her once, then give her a shot of prostaglandin, which would bring her into heat, and then plan on looking at her again probably 3 to 5 days later, with a view to then programming to breed her a couple of days later, and then do the very important check, which is a post-breeding check. So maybe four scans. But in saying that, if you want to minimise your costs, I mean, when you're breeding thoroughbreds, we want to have nice early foals, because then they're older when they go to the yearling sales and things. But if you don't have an imperative to breed early, well, then don't breed early. If you want to minimise your costs, well, then wait till middle of October onwards and breed then, when the mares are naturally cycling. So they'll go through most of the autumn and most of the winter, where they'll sort of have have on and off cycles, and then a percentage of mares will stop cycling, and then they'll have what's called spring estrus or transitional period, where they'll have irregular cycles. And that's where you can be caught. You can get your vet out, scan the mare, and she's got a follicle, and get them out a week later, and they've got the same follicle, and that can be really expensive. And what our starting point, what I actually have first ovulation of the year, and then start from then. So if you want to minimise the number of visits where you're not actually achieving much, well, then just wait till mid-October, when the percentage of mares that are cycling is higher, and then start from then. And so that's
we've got those long daylight hours, and we've got to think that that's what mares are, aren't they? They like the long daylight hours. That makes them cycles. Yeah, no, for sure.
And certainly our most fertile time of the year, regardless, would be from probably mid-November through till the end of December. And a lot of the thoroughbreds are bred well before then, and so we have to try harder with those. But the sweet spot would be from through November through to December, as far as mares going in foal and cycling.
We had a little question here from Kirsten, and you kind of, Kristen, sorry, and we kind of touched on it a little bit about how, like, she's just asking, she wouldn't mind some advice about having a shy breeder. So basically, her mare retired to stud last year. She cycled okay, but she refused to be served. And this will be a thoroughbred mare, I think. And, I've seen that numerous times as well, and it can be a real problem. Any ideas on how you can, any tricks of the trade for that one?
Yeah, I mean, they can be a real problem, and I think thoroughbred studs and stand stay and see these every year. Maiden mares coming off the track just don't like being bred, and obviously there's various forms of restraint that we can use, like chemical and physical restraints, twitches, and putting covering boots on, things like that basically suppress that behaviour. I think a couple of things that may be helpful is one, to give her some, if possible, some exposure away from when she's wanting to actually breed to a male horse. So use a teaser on the mare and try to get used to that exposure to a stallion. And sometimes even just the act of twitching them whilst teasing them, and mares will then, it'll override that initial adrenaline sort of charged aggression they have, and then they'll start doing teasing well, and then they'll be fine from there. And obviously, if it becomes a real difficult thing and you can't even sedate them to cover them, there are some mares that do have hormonal issues and things, and that need to be sorted out in other ways. It's uncommon for sure, but the unfortunate thing, it edges them more to teasing to get them used to that behaviour. It comes down to sort of more sorts of restraint and probably some sedative, really. So. Yeah,
I find it's interesting. I've worked on many stud farms across my career as well, and some use a teaser a lot, others don't have teasers involved at all. And my personal opinion is it really helps having a teaser there. Like, mares seem to be far more receptive to stallions. They cycle better. Is that something you've noticed, or is that just me thinking something off the top, and talking rubbish?
Yeah, no. I think the absence of the teaser on farms is a big loss to the breeding industry, and we see on AI farms. I mean, there's no need for natural cover. They don't need the mare to be in a standing heat, so they're not teased, and I think that's something we're really missing out on, because it's a natural exposure and a learn. It's something that mares will learn to do, to express teasing behaviour, like estrus behaviour towards a teaser. So I think it's helpful to do it, but it's also I think the number one reason why ovulation drugs fail and we have to rebreed mares or re-inseminate mares is because they're bred or inseminated when they're not in good heat and they're not showing good signs of heat. And so, I mean, it's very common. The scanner or ultrasound scanner, we can get in and have a good look at the reproductive tract and see that they've got a big follicle and things. And it can be too easy to just go off and order semen and or just be worried and think we have to order semen now, we've got a big follicle. But if the mare's not well in heat, she's just not going to go off, not going to respond to drugs, and then likely to not go in foal. And so I think the ability to tease mares is very important.
Yeah, I just had a picture here that I thought I would show. That's like a really nice big follicle. You probably can't see it, so I'm not sure if you can or not.
Yeah, no, I can see that. I mean, so that's a
you
pretty
can.
that's a pretty good typical picture of what you'd
Yeah.
like to see the mare that's well inhibited or inseminated or covered. I mean, she's got a nice follicle that's starting to soften. She's got quite a lot of edema or folding in a uterus, which is the image on the right, and it looks like a cross section of an orange, like a segmented sort of appearance. And so that's good. But you can also get that similar situation with the mare that's not in heat. And so if you have a problem breeding mare that missed the cycle because she had inflammation in the uterus, she may come back. You're at 16, 17 days post-service. You're preg testing her to make sure she's not in foal. You can't find a pregnancy, and that's what you're confronted with. She also may have a large follicle, corpus luteum, or the results from the last ovulation, and that's producing progesterone. And the reason she's got that folding or edema in the uterus is because she's inflamed, and she's not in heat at all. She's just inflamed and not in foal. Because she's not coming in for another 3 or 4 or 5 days, and so that's difficult. And so just because you see that doesn't mean that the mare is in heat and ready to serve or to order semen for. And people, because we manipulate the cycles by using drugs, people sort of think, oh wow, I've got to order semen, she's going to be off in 2 days. But they're in heat for 5 to 7 days, and so I mean, and you've got plenty of time up your sleeve to order semen and get it transported to you, or to take her off to stud and things like that. So I think to know that she's in heat, and if you don't have the luxury of a teaser to see that she's showing standing heat, well then certainly what the veterinarian will often do is clean her up and do a vaginal exam and feel her cervix and see that that's softening or soft, and the mucus that's in there is quite runny rather than being sticky sort of mucus. And they're good indicators that the mare's well in heat, as opposed to just going by what you see on the scanner.
I actually had a nice picture of that. However, that got me banned from Facebook. Right. So we won't be showing pictures of nice soft cervix. But
yeah, I think in the absence of a teaser, to do a vaginal exam and feel the cervix, I think that's a good compromise, and to know that that's where you're going on. I mean, if you're AIing, you're going to feel it already, but if you've ordered the semen and the first time you feel the cervix is when you inseminate her and find that you've got a really tight cervix where the mucus is sticky, well then it's just a waste of time. She's not going to go in foal. So.
Absolutely. And if we start to talk about some of the issues that we can get, there's a little picture I had of a mare standing ready to be inseminated. But one of the pictures I was going to find here was, and that's an embryo, so we can actually impregnate mares now, and not thoroughbreds, not for the racing industry. However, we can do that and remove and do embryo transfer, which is pretty cool. But what I really wanted, here's a few pregnancies here, but what I really wanted to show was a picture of, let me see, coming through of, where is it? It always happens. Where is it? Ta-da! Yeah, so we've got our little twins. So if you're doing everything yourself, and, well, when I say yourself, as an owner, and you think your job is done as soon as you've taken the mare to the stallion, or you've had the AI performed, the most important thing, next most important thing, you mentioned, actually, after the post-breeding check, is a scan for twins. Wouldn't you agree?
Yeah, absolutely. And so a timely first pregnancy scan is critical. And since we're using generally very fertile stallions, we're using ovulation induction drugs to help make things convenient and less expensive. our chance of getting twins is increased. And so it's quite a common thing we see, twin pregnancies. And at this stage that you're showing in the picture, I mean, you've got two spherical pregnancies that are there in the uterus. And look, it's important that we do that first pregnancy exam around 14-15 days after ovulation, or around 16 days after the mare has been inseminated. And the reason for that is, if we go too much earlier than that, we may not see a pregnancy that's there, or more importantly, we may not see a second pregnancy that's there, because they don't always ovulate and release the egg and form the second pregnancy at the same stage. So there may be a delay of up to 2 days in between them, and that's a significant difference in size. And so we don't want to go much earlier than that, but equally we don't want to go much later, because when we've got pregnancies that look like the ones in your picture, they're very round, they're very manipulable, and although it's not a pleasant thing to think about, but what we need to go in and basically squeeze one of those pregnancies without damaging the other one. And so essentially what we do is to manipulate the uterus via the rectum, move the pregnancies apart, squeeze one without damaging the other, and that's very easily and readily done by your veterinarian at this stage. It's very simple to do. Another 2 days later, what we'll end up with is, instead of nice round mobile pregnancies like we've got there, we'll end up with much significantly larger pregnancies, which are what called fixated. So they're not implanted yet, but they're fixated or stuck in one part of the reproductive tract, and odds are that they'll be stuck next to each other. And so our ability to reduce the twins by removing one without damaging the other is much reduced. And so we're then forced to use much more advanced procedures, either at that stage or later on, to remove the second pregnancy, which is just going to be more expensive, and our chance of maintaining just one is reduced. And so that first pregnancy test, 16 days after service, 14-15 days after ovulation, is critical to do that, to know that she's pregnant, but also to see if she's got twins and deal with that, which your vet can readily deal with. So
the 14 to 16 days and is when we should be looking for twins, everybody. I think I had a nice twin shot, which was actually an oopsie daisy. Not mine. This is not mine, people. Not my mistake.
And look, twins, the thing about twins is that they can be carried to term. That's very uncommon they'll be carried to term. They can also reduce themselves, like they can early on in pregnancy. So in the first sort of 50 days, they can reduce themselves, or first 100 days, they can reduce themselves. You don't have a second one there. But you don't want to take the chance of having two quite advanced twins that are basically competing with each other, uterus and nutrients. And what you'd end up doing is losing both of them, and or getting a very runted foal, because its twin has taken nutrition through most of its pregnancy. So it's much more sensible to deal with them early on and not to let them go through.
Absolutely. So everyone, just if you've got any questions, make sure you pop them in below. We can get Dr. Simon to answer those. And let me see. Oh gosh. I've got a question here from Kirsten. She's been recommended to bleed her horse. I'm not sure how that's related to actual breeding, but it's some sort of old-fashioned thing, Simon.
Yeah, so bleeding horses, and I assume by that she means exsanguinating or taking a large volume of blood out, is a very old-fashioned thing, which you just don't hear many people ask to do that these days. And I guess there's various...
Not for breeding.
Yeah, or not for particularly any reason. I mean, there's various reasons why people do it. I mean, they think they're removing toxins or viruses or bugs or things from the horse's system, and there may be some role in stimulating the natural production of red cells, but I can't think of any indication for breeding how it's going to make a difference.
Yeah. So, are there any other sort of problems that you might see on a regular sort of occasion that you might like to quickly touch base about, and how we can actually, you know, circumvent any of the problems? Is there anything that you can think of?
Well, I mean, I sort of mentioned it before when we were going through what the minimum checks would be, or examinations would be, and other than looking at the mare, seeing where she's at in a cycle, then one to program her to be bred. Probably the most important one is a post-breeding check of the mare, and when we say that, we mean having a look inside her with the ultrasound, seeing that mare is ovulated. So when you breed them, you want them to ovulate a few days of being bred, and that's going to optimize your chance of getting in foal. But also you want to make sure it's normal for a mare to clean herself up. So the fluid that's been inside her, whether natural semen from natural service or extended semen or frozen semen, that should all be eliminated from a reproductive tract. There shouldn't be any signs of inflammation or any accumulation of fluid in there. And then the chance of the mare going in foal is quite high. But it is quite common for us to see inflammation post-breeding and leading to infection in the uterus post-breeding. And so certainly, if we can detect that in a timely manner, within a couple of days of being served, we've still got plenty of time to clean the mare up before her reproductive tract closes. And are you still there, Leigh? Oh.
Can you hear me?
Yeah, I can now. Sorry, I lost you. And so if you look at the mare for a post-breeding check within a couple of days of breeding, and then we've got plenty of time to then clean her up, treat her, lavage her or flush her, put some antibiotics in, do other treatments or recommend other treatments to ensure that we optimize our chance of going in foal, and then obviously to schedule a pregnancy test as well, and to have an idea if we're going to see twins. And so in my experience, when I go from not on the large stud farms, but go to individual breeders, it's often the exam that's missed. And I think that's not good money saving. I think people that don't look to see that the mare is ovulated and don't look to see that she's clean after breeding are really wasting all the rest of the money they put into the cycle, because that's a critical check. It's a critical check that it goes in foal.
Yeah, because there's a lot of things we can actually do at that stage to help the mare, to clean out that fluid. And again, also, yay, she ovulated, or no, she didn't. But even when there's fluid or there's something like that, we can give what we call post-irrigation or post-breeding irrigations, and do that sort of thing with antibiotics, using things like oxytocin to help muscular contraction to remove all that debris. So yeah, it's spot on. It's something that's really crucial. And yes, I noticed that too. A lot of people would miss that crucial step of the whole process, and it can actually end up costing them more in the long term.
Exactly, and I'm not promoting that every mare gets treated. I don't believe in that at all, and certainly I don't promote that every mare gets treated with antibiotics. I think we need to be very sensible with our use of antibiotics even in the uterus, but every mare should get checked. I mean, they should be checked within a couple of days of breeding to see that she's gone off, to see that she's clean. Pregnancy tests, they're the three things that you want to know from that check, and that's the check that's commonly skipped, and yet that's the time when you're going to have your earliest indication of a problem breeder, the mare that's inflamed or has fluid or hasn't ovulated within 2 days of breeding, and that it gives you plenty of scope to go and correct that rather than missing the cycle, so which you're likely to do. Got a problem then.
Others, is there anything else you'd like to add that would really be beneficial for people, knowing if it's the first time they've bred their horse, or whether they're thinking about doing it for the first time?
Well, I think a few, top tips. One is to do your research. I mean, if as far as the stallion's concerned, whether it's frozen semen, chilled semen, fresh semen, do your research, ask around in your breed society or friends or something like that. I think because there's so much competition now with stallions, whether it's chilled or fresh or frozen semen, the sub-fertile ones or the poor operators are just weeded out because people don't use them. But it's important to find out that the stallion is fertile. know about your mare and discuss the mare with your veterinarian. I think that's important, if they have a good grasp of the history of the mare, and then you can get on top of things early. And so instead of just using the first cycle to learn about the mare, you can, like I said before, you want to do everything you can in that first cycle to optimize your chance of going in foal, and not be one of those 30%ers, but being one of the 65%ers that you've got two-thirds of a chance, or like 65% of chance of going in foal the first time around. Like I said before, breed in the breeding season. If you can delay it till October and breed the mare then, I think that will really improve your chances, but also reduce your costs and increase your chance of getting the mare in foals. And use someone that's experienced. I think if you can make the investment in the first cycle to use the fertile stay in, do everything you can for the mare, use an experienced veterinarian to get the mare, to work on the mare, and I think you're going to put everything in your favour of getting the mare in foal first time around, and then you're going to minimise your costs, minimise the hassle, and it's one less thing to worry about as you go through the spring and summer then. So I think that's
no, it's very, very good advice there, Dr. Simon. So remind people exactly where you are from, and oh, actually, we did have a question. We've got a question here. Who is it? Let me see. Brian. So Brian's asking, do you think it is better to let an older mare, 16 plus, to start cycling herself and skip the first ovulation, or should we try to manipulate her by putting her under lights, rugging, boxing, and basically which way would make a quicker response? Obviously they're wanting to get her, obviously she's a thoroughbred, I'd say, from from this, and they want to get her to try and start cycling early. This also brings up the discussion about age of mares when you're breeding. So any thoughts?
Yeah, so there's a few things there. I mean, as far as mares cycling early, we haven't talked about that, but I mean, there are, particularly with the racehorses and the standardbreds, and so it's quite common from the mid-June to the beginning of July for the studs to start, or breeders to start to what we call putting the mares under light, so exposing them to longer day length by leaving lights on or putting special masks on them. And the idea of that is to make them think that they're in the spring now and start to get them moving, because the number one environmental drive for mares to start cycling is increasing day length, and so the aim is to give them a big burst of increasing day length by increasing the light. That accompanied by rugging them, increasing their feed, bringing them in at night, all help to increase your chance of having your mare cycling pretty much at the end of winter, the very beginning of spring, rather than in their natural breeding season. And so as far as the age of the mare is concerned, I mean, we're manipulating the light, we're giving them extra feed and things, but we're basically just driving something that occurs naturally. So it's not an art, it's a regime. I don't have a problem with that with an old mare. I don't think that's a factor as far as that's concerned. I think if anything, with an older mare, she's been a problem breeder, you might want to make sure that she's breeding early in the season for two reasons. One, because it gives you more breeding opportunities through the season. I mean, if she's dry, she missed last year, it gives you more chances when she's a poor or fertile mare anyway. But secondly, I think you'll find that with the stallions, their fertility early, and when they get busy spring and early summer, it's a real battle, and the stallions sometimes are just kaput, and their fertility and libido really declines. And so I think if you can get a good fertile natural breeding to your old problem mare early in the season, I think that's a sensible thing to do. As far as age of mares, they're all different. I mean, some mares can be old at 11 or 12, and some mares can be still young at 18, 19, 20. So there's no hard and fast rule, other than to say the more important thing rather than the age is their reproductive history. If she's a 16, 17-year-old or even a 12-year-old maiden mare that hasn't had a foal yet, they present their own problems as far as their the reproductive tract hasn't had the softening of the foal going through the cervix and things, and they can have their own problems and behavioural issues and things that make it harder to breed. Similarly, been highly fertile and had a foal every year from when she's 7 and she's only 13. I mean, every time she has a foal and gets bred, that's certain insults to the uterus, and so the lining of the uterus, the endometrium, succumbs to those, and so she, if she's been bred every year and had a foal every year, she may than a mare that's only had 1 or 2 during the same age. So they're all different, and I think only by examining them, knowing their history and having a look inside, you're going to be able to how to manage them through this.
Absolutely. I think, are you still there, Simon?
I am, yes.
Oh, good. I just at the end there, it just sounded like it dropped off a little bit. I hope that helps, Brian. That was really good. Thank you, Simon. If you want to remind people which practice you are at, I think it's, I'm just going to write it. So it's Victorian, oops, can't spell, Equine Group, isn't it?
That's correct, yeah.
Yeah, so the Victorian Equine Group, that's where Dr. Simon's based. So if anyone needs to have a little bit of advice or wants to get a specialist equine repro vet out, that's where Simon is based. And yeah, other than that, I think I've certainly enjoyed this chat. It's been great learning all about what goes on with the mares and getting some really good information here. So thank you very much, Simon, and hope you enjoy the rest of your evening.
Thank you, pleasure.
All right then, well everyone, I'm Dr. Leigh and this is Your Vet Online, and thank you for joining us. And yeah, it was great to have Dr. Simon Robinson with us this evening. I hope you guys learned lots and lots from all of that. We'll have this up on the website, so if you need to get back in touch, head over to yourvetonline.com, where we will, you can ask any more questions you like. Of course, it's always going to be on our Facebook page too. All right then everyone, you have a good evening. We'll catch you later. Bye.